Well, just when you thought the big, beautiful bill couldn't get any worse, guess what? It got worse. So it passed the House a little while ago, and it just passed the Senate, and they had another version, and I guess they decided our vulnerable populations, our elderly, the disabled, the people that really need health care and need stuff to get by on a monthly basis. They need to feel a little bit more pain. So they've piled on some more pain, and we're going to talk about that today. And politicians, I'm sure you're going to hear the talking heads. They're going to come out. Oh, we're just delaying some regulations. We're not cutting anyone's benefits. We're being fiscally responsible. Well, let's go through all that today. So the new bill cuts $793 billion from Medicaid over 10 years. That's about over 10 million people will lose coverage. So we're talking Medicaid, people will lose coverage. People will lose coverage from the Affordable Care Act, the marketplace insurance. And because this big, beautiful bill will cause a deficit, a monthly deficit, a yearly deficit, that automatically triggers what's called the pay-go system. So the pay-go system, anytime you have a deficit, then the pay-go system, which was passed in 2010, says, okay, you've got a deficit. You've got a yearly deficit. You need to find money someplace else. You can't find it at Social Security, that's exempt. You can't find it at the VA, that's exempt. Next place you can go is Medicare. So we're going to, after this passes, guess who's going to be in charge of finding those savings in those cuts in Medicare is the Office of Management and Budget, Russell Voigt, who is one of the prime architects and authors of Project 2025. So he is going to have a nice little birthday present when he gets to go in there and cut, not necessarily with a scalpel, and I'm sure he's going to be using Elon Musk's chainsaw to go into Medicare. But that's the next step. But for right now, let's stick to Medicaid. So about 10 million people, hundreds of billions of dollars more are going to be cut for Medicaid. And the politicians again say they're not really, cutting, yada, yada. They're just, saving, being fiscally responsible so they can, pass more tax cuts on to predominantly the 80% of the tax cuts to go to the very, very wealthy. So Senate versus the House bill. So the Senate cuts $168 billion more. And then there's this thing called a provider tax. It gets kind of wonky. And basically what it is the federal government pays states for reimbursements for Medicaid. How much the states pay for Medicaid, the federal government reimburses them. So there's a percentage and stuff like that. Super long story short, super technical, long story simple. The states are going to get a lot less money with this new bill, and they're going to get a lot less money. So they're going to have a lot less money to help people in their particular states get the health coverage they need. So you're going to get a lot of people that are going to lose Medicaid because of this. And you're going to see, I did a video on this a few days ago, hospitals closing down because hospitals depend on Medicaid, Medicare, the Affordable Care Act. And when those get cut, you've got about 900 hospitals throughout the country that are vulnerable, that are financially vulnerable. So they are just surviving right now. And then when you get all these cuts, you're going to see a lot of hospitals go under. Well, they're not going to go under yet. There's vultures circling around called private equity. And these private equity firms, it's happened across the country already, but now it's going to be on steroids. These private equity firms are going to swoop in. They're going to buy up those hospitals at the pennies on the dollar, and they're going to cut this and cut that and try to flip it and try to make a quick profit. And who's going to pay for it? Unfortunately, the people that live in those communities, predominantly rural communities. So that is one strategy they're doing, is to provide these the states with less money. And the other thing, their eligibility rules. So the Biden administration had passed a series of rules that it says, hey, government, state government, federal government, you guys really need to help people. These vulnerable populations, they're disabled, low education, the bureaucracy is difficult to deal with, and they're on disability, elderly, whatever the case may be. Y'all need to help them navigate their benefits. What we do here on a daily basis. You need to help them navigate their benefits. So some of the things that the Biden administration passed was one of them is called the Medicare Savings Program. It's been around for a long time, and I worked at the Social Security Administration, and we've been complaining for decades that that system is just way, 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 way too complicated. And finally, after years and years of yelling and screaming, they finally came up with a rule that said, okay, hey, we need to make this system a lot more easier, because if people have Medicaid, when they have Medicaid, the state can pay for their Part B premium, that $185. But in order to get that, in order to jump all those bureaucratic hurdles, it was a nightmare. And a lot of people just gave up, and they didn't know, they didn't have the particular form that they needed. They didn't have this, block checked, and they forgot to, sign here, and they forgot the date or whatever the case may be. And the Biden administration says, y'all need to help these people. So those were the rules. And the new this new Senate rule just says, we're going to delay some regulations. We hate regulations. So one of the regulations that was passed during the Biden administration, that evil dude that everybody hates, made it easier for people to get the benefits that they're eligible for. That obligated federal and state employees to help people. And it's difficult now because there's no staffing out there. But anyway, so that was supposed to go into effect. And the eligibility rules, those rules to help people, the current Senate bill stops them. So what is the effect of this? Less money to the states. States are going to cut back. Hospitals are going to go down. Private equity is going to come in there and buy them out, and just flip them, and it's going to turn into a TGI Fridays or something. You've got people that are going to fall through the cracks, and the politicians are going to say, hey, we didn't cut any benefits, even though a lot of people are going to get their benefits cut, even though they're eligible for it. They are eligible for those benefits, but they're not going to be able to receive them because they missed this form. And now the Senate bill also makes those recertifications more frequent. So previously you had to recertify that you're on Medicaid, just like, with other, welfare-based, needs-based programs. You have to recertify every now and then to make sure, you didn't hit the lottery $1 billion. And so it used to be every year, but now it's going to be a lot more often, and there's going to be a lot of people. So the end result is a lot of people are going to get kicked off their benefits, kicked off what they are eligible for. So there's going to be politicians that say, hey, we're not kicking anybody off the benefits. We're not reducing benefits. We're not doing this. We are just rolling back regulations, onerous regulations. We are just, making these calculations a little bit. We're being fiscally responsible. But again, it's not being fiscally responsible when they just take those savings and just decide to go ahead and give it to cuts to, the very, very wealthy. So that, the ultimate fiscal responsibility. If they're going to use it to cut, the deficit and pay for our debt, so we don't have to give it to our kids and our grandkids, then perhaps maybe we could possibly see it, but that's not what they're going to do about it. So that is the nature of the Senate bill that has just passed the Senate. They decided the House was just too nice to essentially poor and vulnerable people and elderly and the disabled. So they decided to get their ounce of flesh added in there. And so reach out to your politicians. If you agree with it, reach out to them. Says, great job. We need to get these people more skin in the game, I guess, is what Dr. Oz said, and some politicians said. These people. But if you disagree with it, make sure you reach out to your politicians and say this is completely unacceptable. Okay, let's get into the live Q&A today. Already got a bunch of questions. Someone asked about their brother wants to file for benefits, for disability benefits, and wanted to know what type of ID that person needs. Don't really need necessarily, any kind of document records, documents from your doctors or anything like that. I've on my website, it goes into on mygovexpert.com. You go in there and you click on the disability, and I give you the application process and kind of some how to do it. But the medical records. Sometimes it depends on the nature of the disability, but if you have a whole bunch of medical records, usually the Social Security Administration, DDS, the people that actually do the medical portion, they don't like to get the medical records directly from people that are filing. Why? Because people, if they send out 100 pages of medical documents, and those are from different times and stuff, and they're usually not numbered in terms of page numbers, and there's just 100 documents from medical records from different times and different doctors. People have, I know you're going to be surprised, people have pulled out pages that were not beneficial to their disability. So because of that, usually when you file for disability, you sign an SSA 827 authorization for release of medical information. And so Social Security, the agency that does the medical determination, DDS, they get that documentation directly. So your brother doesn't necessarily need anything. Just go online. You can help him file online. I always recommend do it online, and because that way you've got more time and you're not pressured. If you do it over the phone, Social Security employees have about 45 minutes or an hour to get through your claim. And sometimes, it's because they're so understaffed, they've got another 400 people to help out. So if you do it over the phone or in one of the local offices, then, make sure you tell them, hey, it's going to take how much time it takes. So if you have a next appointment in the next 45 minutes, then, tell them you're going to have to, delay it. So it's unfortunate. Reach out to your politicians and tell them they need more staff at the local offices. So Beverly, if you research well, you'll know they're trying hard to cut Medicaid. Keep digging, do research. Yes, don't have to dig very hard. Just download the new Senate version of the big beautiful bill, and you can see around the face of it. But again, yes, they do kind of. They're good, they're politicians, and they say, yeah, we're not cutting anything. We're just making them more streamlined, and we're cutting out regulations. Everybody hates regulations, like the regulations where, hey, federal employees, state employees, your job is to help these people. We're cutting out that nasty regulation because we don't want that. We must always be positive. I agree. Help one another no matter the need. Yes. If these cuts happen and so many people are going to fall through the cracks, they need, if politicians aren't there to help them, if federal employees, state employees aren't there, they don't have the time or the effort, the resources to be there to help them, it's incumbent upon us. So please like and subscribe and share and all that kind of good stuff, but look out for those people around you. Please, please, please. And more, our brothers and sisters on Social Security, because if this bill passes, we're all going to need help. Thank you, Dr. Ed. Yes, please. We've got the best community on social media, because y'all always do that. You always look out for each other. So let's see. Please let us know as soon as your son have the information about life insurance for SSI recipients. Okay, I will do. Absolutely. He should within the next few days. Susan, my brother is 66, retired at 62, and is collecting Social Security. He does not qualify for IEDS benefits because of his earnings. Do the same earnings restrictions apply to ex-spouse death benefits? No. Independently entitled divorced spouse benefits is when you're eligible for benefits on a divorced spouse, but that divorced spouse hasn't filed for benefits yet. So that means that divorced spouse is still out there alive and kicking. Surviving spouse benefits are calculated completely different. For independently entitled divorced spouse benefits, regular divorced spouse benefits, current spouse benefits, your benefit amount has to be less than half. So if the other person's benefit amount is 1,000, yours has to be less than 500. Surviving spouse benefits, that's not the calculation. If your benefit amount is 500 and your deceased spouse or your deceased spouse benefit amount is 1,000, you could be potentially eligible for up to 1,000. So there is no half. You're eligible potentially for the full benefit amount, depending on when you file and all that. So let's see. Bella, what's up? How you doing today? Nelson, hello. I'm trying to We'll get some new people here. Just found out that expanded Medicaid is no longer available when you hit 65. Um, yeah, then so you're in one of the expansion states and you were eligible for Medicaid, but now you're eligible because you're 65, you're eligible for Medicare. But people are receiving Medicaid and Medicare. There's millions of people throughout the country that can receive both. So, and that is one of the programs that they're trying to mess with. It's called the Medicare Savings Program. Um, it's it was a nightmare. I've helped hundreds of thousands of people out with this, and it was a nightmare because they would come into the office and they say, "Hey, I'm receiving Medicare, and I heard there's this Medicare savings program that will pay for my $185 Part B." And we said, "Yes, it's called the Medicare Savings Program, and you apply through Medicaid." And we would say, "Sorry, we can't help you at the Social Security Administration. You have to go down to the state agency Medicaid." So they would go down to the state agency of Medicaid and they would apply for Medicaid. And then they would wait to see if, their $185 were paid. And then they'd call up and they say, "Oh yeah, we paid it. And, we're going to start paying it." Then they'd call Social Security and we would say, "Yeah, we're going to stop charging the $185 as soon as they paid." And it says, "Well, they already paid." So it hasn't gone into our system yet. And so it was a back and forth because you got three different systems. You got the state's Medicaid system, you got the Social Security Administration system, and you got the Medicare system. So sometimes they didn't talk to each other. So these poor people would have to go from Social Security to Medicaid to call Medicare back and forth and back and forth. And it was a nightmare. So Biden finally said, "Hey, we have to end this. We're going to change the rules to make it a lot easier to streamline this whole process so people get the benefits kind of automatically so they don't have to mess with all that garbage." But the Senate says, "No, we want people to ping pong back and forth forever." And so stress people out. And invariably, people will just forget about it. I'll just take the $185 a month cut because I, I'm, I can't make another trip to the Social Security office or the Medicaid office, and I'm not doing anything. They just give up. And that's how the Medicaid saves money and the government saves money so they can give it to the rich are laughing all the way to the bank. Yes, they are. Yes. And we buy it. No, they're not cutting people off that are eligible. Yes, they will. They are. Just like after the Medicaid unwinding, after the end of the pandemic, um, there was about 75% of the people got cut off of Medicaid. 75% of people that got cut off from Medicaid were not supposed to be cut off of Medicaid. There was a mistake, and those people got cut off. So, Miriam became a silver member. John Maynard became a platinum member. Thank you very much. You guys are awesome. Thank you so much for your support. If politicians say we're not going to touch Medicare or SSA, that means they are not going to support or fix it either. Yes, very, very good. I am actually, the new Social Security Trustees report just came out. I'm going to talk about that tomorrow. So the new Social Security Trustees report. So not raising the retirement age or cutting Social Security, beautiful, awesome. But that's like saying, "Hey, I'm not going to light another match on that house that's on fire." So I'm not going to, contribute to that house fire. I'm just going to sit here and watch it burn. So states keep the taxes and send the federal their cut, turn everything 180. Yeah. Oh yeah. So that's the complicated part of the provider taxes. Yeah. The states have been kind of in order to provide their citizens with health coverage, try to get the citizens of their particular state as healthy as possible, and because it's better to provide preventive maintenance and get help people before they get terribly sick, so they have health care. So states have been, I agree, they've been kind of playing around with the calculations so they get more federal funds. That should be fixed, but politicians are throwing the baby out with the bathwater and saying, "Hey, that's not, states are playing around with the money. They really shouldn't do it that way." Yeah, we agree. But that doesn't mean you should now take all that money from the states because people are going to, hurt. So they're using that as an excuse. They're saying, "Hey, these states are, manipulating the numbers." Yep, they are. So we're just going to not give them any more money. But so that's yeah. So and we fall for it. Beverly, I'm calling every other day, Monday through Friday. I don't have Medicaid, never have yet. I know it will hurt millions. I'm particularly concerned for NI. Yes, absolutely. The premies is Social Security. We used to actually have someone in our office, Camille. She used to go out to hospitals when they have premature births, SSI and Medicaid, because if they qualified for SSI, then they were categorically eligible for Medicaid immediately. So families at that crucial time really, really needed that. They already have enough issues, so to not have to worry about how all of the hospital bill and everything's gonna be covered. We used to have Camille would go out and get everybody signed up and get them all set up. So that would take one kind of nightmare off of their plate. But yeah, that's unfortunately not going to happen anymore. So a lot more easier. Thought you were a doctor. Yeah, a lot more easier. Yes, sometimes I get a little tongue tied there. More easier, a lot more easier. Yes. To boldly go, split infinitives and everything. Yeah, you're going to hear a lot of grammatical stuff. Anyway, it's live. What are you going to do? The rich will eventually go out of business. Trump already has broken contact with the Federalist Society. I don't know if the rich, I don't think we're gonna have a swan song for the rich. I don't think they're gonna go out of business. That's the reason Social Security is in dire straits, and we're gonna get cuts in the future, is because all the money that we used to make is now going to the top. And once you make over $176,100, you don't have to pay into Social Security anymore. So that's the issue. So we, the people in every state, must get out and vote. Yes, absolutely. Taking our money and us suffering to the end. Is this what those who voted for this mayhem? It's a reality. Complain now is like becoming a millionaire for only one. It's very scary. Yes. So we, the people, have the power. We've just forgotten it. Hear, hear. Time to remember, time to stick together and make sure the people in the office represent what we want, not what they want. Yes, a participatory democracy. It's kind of like being in a car. We're in the passenger seat, most of the time in this democracy, but every now and then we need to grab the wheel and stop it careening off the ledge. Let's see. Kelly, are there any programs for someone that has long-term COVID maybe, and is unable to work, 80 years old, and now has narcolepsy and the fog and other problems? Oh, okay. Not from Social Security. Once you hit your full retirement age, everybody gets kicked off of Social Security disability benefits. It's basically what they do is they switch your benefits from disability to regular retirement. So nobody in America is receiving disability benefits after their full retirement age. Everybody is switched to regular retirement benefits. So, Dari, my Medicaid has already been changed to a huge monthly deductible program since my 6-month certification. No increase or change in my SSDI amount, just a covert change in the medical plans. Yeah, so you have some cost sharing. So that's another thing people don't realize. It's like, well, this person did lose Medicaid. They still have Medicaid, but there's many, many different levels of Medicaid, QMB and SLIMB and QI and all kinds of different. So the higher levels, those are the ones that will pay for your Part B premium. So you have been downgraded. So you still have Medicaid, but you have to pay a lot of deductibles. So it's people say, well, you've got Medicaid, so you get everything. No. There's people that get Medicaid like you that still have to pay a lot out of pocket. And that's because of, your state decided to cut Medicaid, to downgrade people's Medicaid. I've had people that were in one state, they received exactly the same amount from SSDI and had the same amount of income resources, and they had Medicaid in one state. They moved to another state, and they lost their Medicaid. So it's a national it's a federalist type system. It's national versus state. There's some national borders, parameters that the Medicaid, administration and states have to abide by, but the states have a lot of, flexibility in what they can do. Um, my spouse is my current financial representative, but does that give her permission to answer my mailings from SSDI? Um, Financial representative, not sure what that means. If you mean representative payee, so your spouse has been appointed your representative payee at the Social Security Administration, then yes. Yes. So basically, if you have a representative payee and you call Social Security, they won't talk to you. They have to talk to your representative payee. So, but if you're talking about, a power of attorney or something like that, no, that's no. Only Social Security only recognizes the representative payee. And by the way, I've yesterday in my live Q&A, I answered a lot of questions, video questions, and I didn't get any questions today. I feel so lonely without seeing y'all's beautiful faces and your questions videos. If you want to ask me a question more detailed that you don't want to type in here, go onto my website, mygovexpert.com. Click on that little thing on the bottom left, question or comment, and you can record a video. You press submit an answer or something. It's kind of the way they've got the platform. I don't like it, but it's great. It shows the wording is not the best. The grammar is not the best for those grammar aficionados out there. But anyway, but I'll see if I can, see what I can do to fix that. Will it become more difficult for SSDI applicants to get their benefits? As of right now, to get their benefits, to start their benefits, there hasn't been necessarily any changes. I know during the first Trump term, his presidential budget proposals were always included cuts to disability and more recertifications and more CDRs, continuing disability reviews, and all that. This one, not so much. But I'm keeping an eye on that. So I'm not clear. Did the Senate pass this bill? Well, it's not a pass type thing. It's now it has to go back to reconciliate. They have to reconcile the two bills. So you have the House essentially passed, send it over to the Senate. And then the Senate did their version and said, hey, you need to give these guys more pain. So now the House and the Senate has to kind of come together, usually behind closed doors and, secret, 2:00 in the morning meetings, and work out the differences. And then once that is passed by the House and the Senate, then the president signs it, and then it's a done deal. And then all the complaints later mean nothing because we didn't complain or approve it when we had the chance. So some people come on here and says, Ed, just shut up until it actually passes. It's like, yeah, you come to the wrong place. It's like, just shut up until our corporate and political overlords make our decisions for us, and just let us know what they decide. And, that's, and our community ain't like that. So there needs to be a huge peaceful protest by seniors and disabled and their family members who are reliant on these programs will be cut. It should be the next national protest put together. Yeah, one of the problems is it's easy to pick on, poor people because, they don't have the voice that they need. So they need us to go out there and be their voice. They're elderly, they're disabled. They don't know the bureaucracy. They don't know what to do. They don't have the time. They're just, working 80 hours a week, just barely surviving. So they don't have a lot of time to go out there. So there's a lot of reasons. So, Martin Luther King had the poor man's march and all that. So yeah, it's unfortunately they're easy to take advantage of, very easy to take advantage of. It's not as though they can go to Mar-a-Lago like the guy that ripped off Social Security, and his mommy paid $1 million to go to Mar-a-Lago, and he is pardoned from ripping off Social Security, ripping off millions of dollars. So they can't do that. They're already changing Medicaid programs to high monthly deductible plans. My monthly, yes. So we just talked about that one. Yes. No, the bill has not been passed by the Senate. Exactly. So it's kind of left the Senate. So that is their version. But yeah, when you say past the Senate, then then it has to be the final bill. Then it passes the House, it passes the Senate, and that version is signed by the president. So it passed it, but not in the sense of what we're talking about here. So that means we still have time. So if it was already decided and it was passed out by the House and Senate, and it's going to head to the president, then we're pretty much out of time. But luckily, we still have time. But they're talking about fast tracking it. They're talking about now that the Senate has done their thing, they want to pull that Band-Aid off as quickly as possible before we get wind of it. Okay, I already answered that one. Let's see. Let's make it clear this big, ugly bill will force Medicare cuts in 2026. Yes. And politicians will say, no. The big, beautiful bill, there is nothing in the big, beautiful bill that talks about cutting Medicare. And they were right. But then you ask those, but it's amazing. These news outlets, when they do an interview, there was a great interview. Check out the one Tucker Carlson did for what's his face from Texas. I can't remember the guy's name now. Anyway, the guy that supposedly his father shot JFK Castro. I say, well, what's his name? Ted Cruz. Tucker Carlson actually did a pretty good interview with and asked him some really tough questions of Ted Cruz. But yeah, usually that doesn't happen. I'm not a fan of Tucker Carlson. He's a lot of misinformation, but I like that kind of interview. But if you ask a politician, this is going to cut Medicare, right? And they'll say, no, nothing in there. That's misinformation. That's, fake news. There's nothing in it about Medicare cuts. And then you say, but this causes a deficit, right? Yes. Okay. I'm sure they'll, come up with some fake numbers. And okay, let's say theoretically it comes with a deficit. So if a deficit happens, isn't there a bill called the pay-as-you-go bill that says if there's a deficit, then there automatically has to be cuts, and those cuts are determined by the Office of Management and Budget. And isn't that person Russell Vought? And isn't he a Project 2025 guy? And isn't the major program that can be cut Medicare? And then watch the politicians squirm then. So the senators have not voted on the bill yet. Call your senators. Yes. So it's been passed out, and so it's been made public. But yes, we still have time. Do we still get our Social Security going forward? Yes. Social Security, this is another thing politicians do. They, completely doom and gloom. There is doom and gloom, but there's gray areas. It's spectrum. Social Security, as long as we don't privatize it, give it over to Wall Street, Social Security will be around here for 100, 200, 300 years. Will your check be what your check is now? If you're getting $2,000 a month, will it be $2,000 a month after 2034? No, it'll be about $400 less if we don't do something. So, but Social Security will still be here, but the trust fund is running out. And I'll talk about the new trust fund, the trust fund and the new trustees report tomorrow. Can we get word out to representatives to eliminate FICA tax? To eliminate FICA tax, then Social Security, then if we eliminate FICA tax, then Social Security's done. Then that'll kill Social Security. You mean the cap on FICA tax? Yes, I agree. We all agree with that one on regular viewers to my channel. So let's see here. Is the 8% compounded for the 3 years, and does it matter if they cut it in 10 years? Okay, so you're talking about delayed retirement credits. What's up, Easy Eddie? Um, so if you wait to collect your Social Security benefits after your full retirement age, then Social Security increases your benefit 8%. So if your benefits are $1,000 at 67 is your full retirement age, and if you wait till 70 to collect those benefits, 24%, so your benefit will be $1,240. So, and yes, if we don't do something, then then you're going to lose that $240 basically, because there's going to be a cut in less than 10 years. So, and this is not, Social Security law says that Social Security can only send checks based on what it has. And if all it has that month is how much they receive from FICA tax from people working, and all they receive is 80% of what they need, then they're going to send 80% of your check. Right now, the trust fund is covering that gap. So right now, it's basically they have what I'll have to double check the details of the new trustees report, but it's about, let's say 90%. Right now, they have 90% coming in every month, so they can pay out 90%. And they also need to pay the other 10%. How do they do that? They have the savings trust fund. So they take out that 10%, stick it to the 90%, send you a check. But in a few years, they're not going to have that anymore. So regulations protect people. Yes. Yeah. All these politicians and everything love regulations to protect them and their constituents, which is their, big corporations. But yeah, they don't like it for us. Upton Sinclair, The Jungle. Yeah, all those terrible regulations about keeping rats out of hamburger meat. How dare they? Extra protein. Joni Ernst, Iowa senator, commented that there was $580 billion over the last 5 years in waste in Medicaid. Any truth? There is waste in Medicaid. There is waste in Medicare. There is waste in Social Security. There is waste in credit card companies, banking, farming. Every entity has waste. Should we focus on Medicaid waste? Yes, absolutely. Because that will keep benefits going longer if it goes to the right place. Yes, there definitely needs to be addressed there, but yeah. So that's kind of the cover they were using, for the last few decades. The way to get more money to the rich is saying, well, if you give more money to the rich, it'll eventually trickle down. And after about 30 or 40 years, we realize it ain't trickling down. So they stopped using that. And now the new thing is fraud, waste, and abuse. So if they say fraud, waste, and abuse on anything, then that gives them carte blanche to do whatever they want to do. So. Have members of Congress, senators forgotten there's an election in 2026? No, they haven't forgotten, but they don't care. Who knows? Yeah, if they pass all these laws before then they lose. Then the revolving door. They go to the corporations that they're currently helping out, and they said, "Hey, see how many billions of dollars we saved you? I just got fired by my constituents. You gonna hook me up?" So, and the Supreme Court says that's not bribery. They're cutting people that shouldn't receive it. That's where the cuts are coming from. People that are able to work and shouldn't receive it be cut. Yeah, I wish that was true, David. I wish that was true. My husband is a disabled veteran rated 100% and collecting SSDI. Does he need to give SSA a copy of his DD 214 to get more money? If he's a disabled vet recently, then no, it's all automatic. You're talking about if you worked, if you're active duty in the 70s or something, Social Security, they give an extra $100 per quarter of earnings for 1970. They don't give you $100 extra per month or anything. People that get that, it increases their benefit a buck or two or something like that. But if your husband filed relatively recently within the last 5 or 10 years, then his military service was already included. If you're uncertain, just call the 800 number and say, have him call the 800 number and say, hey, was my military time included? And there's a little code on the MBR, the Master Beneficiary Record, and it'll tell him. So pretty easy. But yeah, normally it's included in there. Don't trust a liberal Democrat that is speaking. Yeah. So, yeah, that's what politicians, divide and conquer, have us attack each other and call each other names. And so, as long as you can call someone else a name, then you don't have to listen to them anymore. And therefore, the the democratic dialogue ends. So, can't imagine the big destructive bill. Our Social Security money, $185 for Medicare, then 2034, 20%. That's almost $400 cut to everybody's checks in 2023. Yeah, not everybody. So it will, looks like about 19% cut in benefits. The $185. So yeah, it's those people that get kicked off of Medicaid, because the states cut back or they, are not able to navigate the bureaucracy or whatever the case may be. And one day they were receiving that extra, the Medicare Savings Program, the $185 help. So they will have to pay that now. So they'll have, it's just a triple whammy. So the people that are eligible for those benefits but get cut off. And so David thinks the government bureaucracy is 100% accurate at all times. So David has way more confidence in the bureaucracy than pretty much anybody else. He believes that only the Medicaid, the state Medicaid offices, and Medicare and Social Security is 100% accurate at all times, and they will only kick off, that young kid in the parents' basement playing PlayStation. They won't accidentally kick off, the grandmother, the disabled person because they forgot to fill out the paperwork. So David has a lot more confidence in the bureaucracy than the rest of us here. So you've got someone that has Medicaid and they forget to fill out the form, or the state gets cut back. So they lose Medicaid or they're downgraded into Medicaid. So they have to pay the $185. And if they lose or are downgraded, then they're going to have to pay a lot more for their health insurance, deductibles and co-insurance and all that kind of stuff. So they're losing money there. So that's that money, the $185. They might lose the extra help with prescription drugs. That helps them with their prescription drugs. They might lose if they have a Medicare and Medicaid, the Medicare Advantage dual eligible plan, because they're no longer on Medicaid. So they'll lose that grocery card that they may have had, $100, $200 there. So yeah, they could be quadruple hit. So it's going to hurt a lot of people, unfortunately. David is good because he thinks the bureaucracy is 100% accurate at all times. So yeah, not so much. I'm here to tell you. Let's see. Do they give tinfoil hats at SSA? Yeah, I always wanted to wear a hat. It's kind of, the male pattern baldness, cover that up. Everybody is going to be forced to live with a family member or be homeless. Yeah, certainly. Well, it's and that's another thing. There's the part of it is also the cutting back on the electrical assistance. Meals on Wheels is being cut back. On my website, a new thing I added in the last 10 days is living on Social Security alone. And it, goes through all the different, the food assistance, Medicare savings program, which we're talking about a lot today, SSI, healthcare assistance, Medicaid, which we're talking about, the extra help with prescription drugs. Right now, there's millions of people that are eligible for the Medicare savings program that don't get it. There are people that are eligible for SSI. I just did a video. My video yesterday was about SSI, and I tried to, do the provocative, title to get, you got to play the YouTube game, that SSI is welfare. That always gets a lot of clicks because, number one, people think SSI is Social Security, but it's not. It's supplemental security income. So they say, it's not welfare. I pay for. No, SSI is welfare. So, and the reason I do that is because we need to get the word out there. So hopefully someone watched that video, and you might share that video and subscribe and like and all that kind of stuff. And then someone somewhere in the country realizes, oh, wait a second, I can get SSI. Oh my gosh, that's, now I'm, going to be able to buy food more than, yeah. So hopefully, and I'm sure all of our regulars in here, Took, and Bella, and Nelson, and Penelope, and all of our regulars in here because they share and subscribe and like and all that kind of stuff. Even pushing the button, I'm sure it helps people out because it gets to more people. Social Security will have to cut soon. Call your congressmen and women now. Tell them that you're among a growing voter who won't stand for inaction. Yes. And it's good that President Trump said, "Hey," and that's one of when they passed the Social Security Fairness Act just a few months ago during the Biden administration. There was also a midnight attempt back, in the middle of the night, attempt to raise the retirement age, and that could have gotten some action and some traction, but President Trump said he's not going to cut Medicare, he's not going to raise the retirement age, not going to cut benefits and stuff like that, which was awesome. And I think that's possibly why that didn't succeed. I think it had a slim chance, but at least it wasn't pushed even more. And why the House, there's a lot of members in the House and the Senate want to raise the retirement age and cut benefits and all that kind of stuff. But President Trump said, no, absolutely not. So I think that's good. So kudos to that. But as somebody pointed out, not doing anything is also going to get cuts in the future here. So we need to do something. We need to fix it. And most of the people in this, in our community don't believe that, cutting benefits for those people that really, really need it is the solution when there's so many other solutions. Can you explain what qualifies you to receive disability benefits? I've had 2 heart attacks, have stents, have 8 injured discs, tear in shoulder, bursitis on the hip, sleep apnea. Is there any government benefits for divorced women? Okay. So if you are 60 years old and you were married to someone that passed away, and to be married, 10 years, if it was a divorce type situation, you can receive benefits on that person's record starting at 60 years old. Surviving spouse benefits starts at 60, unless you were disabled. If you became disabled, you can file for what's called a disabled widow's benefits between 50 and 59. If that person is not deceased, you can file for regular spouse benefits at 62, divorce spouse, independently entitled divorce spouse. You go on, again, we'll go onto my website and click on the family section there, and it goes into what spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, a little bit more detail there. And then in terms of disability, if you file for disability and you were denied, make sure you file an appeal, a reconsideration. That's the second. A lot of people file for disability and they're denied, and then they just give up. No, never, never, never. Go file an appeal. It takes 10 minutes to file the appeal. SSA 561, super, super easy to fill out. I've got all the details and the forms on my website. So please, please, please. If your disability prevents you from working, that's the key. Your disability prevents you from working. Yes. Spelling is overrated. Yeah, I'm the worst speller. I teach university classes and my penmanship is terrible, so I don't write on the board. I use all PowerPoints, and my spelling, because of the evil Bill Gates doing that spell check for all those decades, I've lost my ability to spell. Even though my mother won spelling contests throughout the state of Florida many times, it didn't click on me. I am QMB class of Medicaid. So yeah, you're the highest level of Medicaid. So I've got a section on that. Sounds like the old, we've got an app for that, right? So there's a section on that, on Medicaid, who it's available for, the income type stuff, the application process, and then the different levels of Medicaid. So your QMB program, SlimB, QI, there's all kinds of different programs, different levels of Medicaid. So yeah, if you're on Medicaid, if this bill passes, then you're going to have a lot more recertifications to do. And if you don't get the paperwork done 100% correctly, make sure you get the paperwork 100% correctly and you do it in time and everything like that, because now there's not going to be any help there for you, unfortunately. So What happened to the 99% movement, the 99% against the top 1%? That was a strong movement. Oh, that Occupy Wall Street and all that. That brought both sides together. I'm trying to figure out how the top 1% diffused that. Yeah, usually by distractions. Yeah, and it's you know we don't need to solve issues. We need to attack each other. Divide and conquer. It's been around for thousands of years, divide and rule. So now it's just, oh, you're a liberal, you're a fascist, you're a reactionary, you're a communist, you're, this, that. And so, yeah, the politicians are just sitting back, just laughing at us, and we fall for it all the time. So, yeah. Voting takes too long for results. I receive SSDI on the 1st. Will that stay the same? Yeah, as of right now. Doge is in charge of Social Security. The new commissioner of Social Security is a Doge guy. He has given full access. The Supreme Court has given full access to Doge people. We forgot, even though Elon Musk is not there anymore, Doge is still in charge of a lot of agencies, including the Social Security Administration. So they are making a lot of behind the scene changes. But hopefully, Social Security employees have been begging, Social Security has been begging Congress to update the Social Security computer system forever. So hopefully they're doing that, but the time frame that they're talking about doing it is completely unrealistic. I hope they're able to do it. David has 100% confidence. I don't. So hopefully they, don't mess something up. But bar that, you're good. So Social Security would have no problems had the government kept its hands out of it and didn't give it away as welfare in the 60s. Okay, yeah, that's 100%. That's what politicians. That's exactly. So that's why we can't have nice things. All right, you go onto my website, myths debunked, and that's a myth. And myth number 1, the Social Security Trust Fund was stolen, given away, raided, or something like that. Yeah, that's what politicians use to shut us up. And it obviously still works. So, yeah, we're, that $2.7 trillion, which the Social Security trustees report just said today, yeah, we've got all the money. It's all fully accounted for. People don't believe it. Politicians don't want us to believe it. So they'll say, yeah, it was stolen and we're still looking for it. They've been looking for it for like 30 years. And, oh, yeah, we're still on the trail. So, but in the meantime, we need to give Social Security over to Wall Street because I'm still looking for that money. Joey, Dr. Ed, can an adult child, 18 years old with autism, qualify for SSI if living with working parents? So SSI is a welfare-based program, needs-based program. So the income, but it's an adult child. I would file in that situation. So it really depends on the living arrangement, how much the parents are making, all that kind of stuff. The law was changed last year to, it's called the ISM, income support and maintenance. It was changed for food and it was changed for for rent. So Joey, I would have that person file, or that person can have a representative. They will be appointed the representative payee. But yes, I would file. Please have that person file. SSDI isn't based on your assets, but SSI does depend on your assets or other income available in your household. That is 100% correct. David, another different David, it looks like. Can you explain how your income after 62, when it has stopped being indexed, replaces lower income that has been indexed? Yeah, just they index it after stop indexing after 60. They just take the current year. So if you're 20, let's say 2024 is $50,000, then that's $50,000. If 5 years earlier was the absolute value of that money was $50,000, but they index it and it's like $53,000. So they'll say, hey, is this $50,000 more than this $53,000? And again, they look at all 35 years. So they just look at the absolute amount. All right. Yes, this current administration wants to make all SSDI and Medicaid recipients work for benefits. Not necessarily all. SSDI, no. There are work incentives, but SSDI, I haven't seen anything about them wanting to. Um, well, I guess under the previous Trump administration, they wanted to make it more difficult to get and receive disability benefits. So that's a fact. But on this second administration, they haven't focused on that yet. Medicaid recipients work for benefits. Yeah. Those that are not disabled or elderly or in school or taking care of someone or something like that. Yeah. And that's about 8%. Only about 8% of people are not in those categories. That, there's a lot of people on Medicaid that do work, but there's a few that don't for whatever reason. So, and that's another thing. It's, you had to do the 80 hours, and people, they get their hours cut back or something, and they lose their benefits because, they only did 79 hours one month. And so they get cut of benefits. And because there's no staffing at the local offices, they go down there to restart their benefits the next month because now they got 81 hours. And then the application takes 3 months and the person doesn't get their prescriptions and they can't see their doctors. And so, yeah, it's a nightmare. How do I know? Because former manager of Social Security Administration. Before I worked at Social Security Administration, I worked at the Department of Social Services, which did Medicaid and food stamps and all that kind of good stuff. So, and no, I was not a government employee all my life. I owned a few businesses, art gallery in Tokyo, all kinds of different crazy stuff. So I have private experience. People say, "Oh, this guy's always been," anyway. So it's amazing what you see on the internet. What if you cannot afford to pay your Medicare premiums after cessation? What did we talk about? So if you, so your Medicaid was stopped or downgraded, and therefore you can't pay for the $185. Then, yeah, if you can't pay for it, then unfortunately, yeah, you're gonna lose it. If you're receiving Social Security benefits, they're going to take that directly out of your check. So if your check is $185, then you get zero, right? Because they're going to take out. But if you're receiving Social Security, they're going to take it out automatically as long as it's over $185. If it's not, then then you're going to lose your benefits because you're not paying the whole $185. If you cannot afford the $185, if you're denied for Medicaid, always appeal, number one. And the other option is what's called a Medicare Advantage Part B give back. This is the only other option. Is you because you have Medicare Part A and Part B, you can apply for a Medicare Advantage plan. I always recommend Medicare supplement plans like a Plan N or a Plan G, but that costs a monthly premium. But a Medicare Advantage Part B give back is, as the name implies, it pays for part of your Part B. So if there's one available in your area, it'll pay for part of your Part B premium, $50, $100, $185. So you can reach out to chapter, or, whoever helps you with Medicare, and say, "Hey, I'm having a hard time. I just lost Medicaid." And if you just lost Medicaid, you're in a special enrollment period where you can switch your Medicare Advantage plan. So you say, "I just can't afford the $185. So help me out. What's this Part B give back? Do I have it?" And then they'll go over all the options. But be careful. These are the Medicare plans. Those are private companies. They're in it to make money. They're not going to pay $185 of your Part B every month without taking something out from somewhere else, charging you more for a hospital or your prescriptions or something like that. So, yeah. If you are scamming the Imaginator, I haven't seen Imaginator here in a long time. If you are scamming SSI or SSDI, they will catch up with you very soon. Beware. I don't know about soon, but yeah, eventually Social Security, when you file for SSI, you give Social Security permission to, keep up on all your financial type stuff. So if you're on SSI, that needs-based program, and all of a sudden somebody, you win $1 billion and it goes into your bank account, Social Security gets an alert that says, hey, a bunch of money just went into this account. And they send a letter to you and say, hey, what's that money? It says, oh, won the lottery, bye. Or, oh yeah, it was a mistake. They put it in the wrong bank account or something like that. Yeah. So even if people don't get recertified, don't have to do the recertification every year, Social Security does get those alerts. They're called diary alerts, and all kinds of different alerts. So, all right, we are over an hour, and I'm completely run out of time again. So many great questions. I'm transitioning to a new computer system, and I might come back here in a little bit if I can get it to work, and I might do a question and answer period about 30 minutes to see if I can get this thing to work. If not, yeah, you know how terrible I am at computers, so I might not get it to work. So you might not see me till tomorrow, but I'll give it a shot. All right. Other than that, I will definitely be back tomorrow, and we'll talk about the Social Security Trustees Report and what you can do to reach out to your politician. Y'all have a great night, and please, 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 please take